have not felt well for almost 2 weeks. I'm going to give you an insight of what it's like to feel awful. Hi, my name is Tara. I have stage 4 breast cancer, and I also have MS, because I'm doubly blessed. I went to the urgent care about a week and a half, almost 2 weeks ago, because I felt like I probably had a urinary tract infection. I cannot feel my bladder because of my MS. I cannot really feel when I have to go to the bathroom. I do not have incontinence, but I just don't feel the pressure. So I don't usually feel when I get a bladder infection, but I do get symptoms. My MS flares, so I'll start to stumble. My vision will go a little bit more wonky than usual, and I'll get pain on my lower right side of my back because I also have a tumor on my lower backbone. So I started to feel those symptoms, and I do need to point out that I usually only feel those symptoms coming on, for some reason, late at night and on weekends. God forbid you feel those symptoms during the week when your doctor's office is open, right? So, I had to go to the urgent care. I went to urgent care. I went in. I've been to this urgent care before. I said I have a bladder infection, I believe. I just need you to run my urine. They did. It came back positive for a urinary tract infection, and they called me in an antibiotic. Now it was late at night. I didn't have many options for a pharmacy, so they called it into the only pharmacy that was open late at night, which was a Rite Aid, which was a little distance away, not the one I usually go to. I drove to that Rite Aid, picked up the prescription, went home, took the pill, proceeded to puke the pill up. It takes a lot to get me to throw up. A lot. I take a lot of medicine. I've been on a lot of medicine. I don't throw up easily. I do have anti-nausea medicine for my cancer. I had to take a lot of those pills that night. I took, I think, like 2 or 3 of those pills because that medicine, whatever they gave me, made me really sick to my stomach, and I couldn't hold the antibiotic down that they gave me. So the next morning, I had to call back the urgent care center on Saturday morning and say, hey, whatever you gave me did not sit well with me. Can you call me in something different, please? I threw that up. I couldn't hold it down. I tried to take another one, or at least a half of it, and I couldn't even hold that down. Is there something different you can call me in? They called me in something different. It was a 7-day course. I took almost, 6 days worth of it, and then I got a message on my voicemail to call them back. They send your urine off for a culture because they just they test it when you go into those places to get an instant result if you have bacteria in an infection, but then they send it off also to get more in-depth information, and that's what happened. Is they sent my urine off for more in-depth information, and it came back. And when I called them, they said it came back, and it said that the antibiotic we have you on, the infection you have, is antibiotic resistant to what we have you on. So how are you feeling? And I said, well, it's kind of a trick question, because I have MS and I have stage 4 cancer, so I kind of always feel like crap. I've just been really, really tired. And they said, well, the infection you have is, the word they used, complicated. Complicated. That's a story of my life. Complicated. It's one we don't see often. She said, we have to put you on this other antibiotic. This was yesterday. Today is Friday. This was last night, Thursday at like 7:30 at night. And they called me in a prescription we're going to call you a new prescription. It's a rather strong antibiotic and has a lot of side effects, but you need to be on this. It's one of the few that responds to what you have. I said, I have a urologist. Do I need to call my urologist? She said, well, let's try this first, and if it doesn't respond to it, you need to follow up with your urologist. I have a whole bunch of ologists. Urology, neurology, oncology, cardiology, a whole bunch of ologists. And I said, okay. So I picked it up at my Rite Aid last night, and when I picked it up, it was a 3-day supply. I have been on a whole bunch of antibiotics in my life. I've never had a 3-day antibiotic, so I was a little confused. I called them this morning when I got up, and I said, hey, it's a 3-day supply. I just want to make sure that's what I was supposed to get. I didn't know if Rite Aid screwed it up, if you screwed it up. I just want to verify, because they said this was pretty complicated, and I didn't want to get the wrong dosage going into Easter weekend when I won't be able to reach anybody. And the doctor said, oh, I'm glad you called me back. Let me look it up. And she said, it says you're supposed to be on this medicine 3 to 14 days. I really don't want you being on it 14 days. I really want you to follow up with your she didn't want me to be on the medicine for 14 days without speaking to my oncologist, or not oncologist, my urologist. So she called me an additional 4 days for the medicine. So I'll go back and pick up the remainder. I did sleep until noon today. Feeling a little bit better. I just wanted to give you a day in the life, in case you're ever jealous. Somebody who stays home and gets disability and sleeps all day. It's a day in the life. Don't be jealous.